Hello, everyone. We're going to go ahead and get started. Thank you all very much for joining for today's webinar on self-care for resettlement staff with Dr. Susan Rema. My name is Katie Litanga, as many of you know, and I am a program officer here at ECDC and also the lead on health and mental health. Before we begin, I just want to bring your attention to the GoToMeeting control panel in the right-hand side of your screen. At the end of Dr. Rema's presentation, we're going to open it up to questions, and since attendees are in listen-only mode, you can use the chat pane on the right-hand side. It's at the bottom of the control panel, and you can pose your questions through that chat function. If you have any issues using that chat function, you can email myself. Many of you have my email address. It's klitanga, Klitanga, @ecdcus.org. During today's presentation, Dr. Rema will discuss the importance of stress management and provide participants with some useful resources for handling the day-to-day pressures of working with refugee populations and coping with what is often referred to as burnout. Dr. Rema has a PhD from the Kent School of Social Work, University of Louisville, where she is also an assistant professor teaching social work practice, practicum, and trauma-informed practice courses. Dr. Rema has an MSW from the University of Maryland School of Social Work and is a licensed clinical social worker in Arizona and Kentucky. She is currently the mental health advisor at the Survivor of Torture Recovery Center in Louisville, Kentucky. So without further ado, I'm going to go ahead and turn it over to Dr. Rema.
Hi, good afternoon. Thank you, Katie. Well, we're going to talk a little bit about managing wellness. And I know that all of you work in environments where there's lots and lots to do. So let's move ahead with, there we go. So what are we going to talk about today? These are two outcomes that I hope that you take with you. One is to improve your understanding of how stress and trauma impact you. And the second is to improve your capacity to maintain wellness in the midst of suffering. And we're going to talk a little bit more about the concept of suffering as we go through this outline. So, just a quick overview. We're going to start out with defining several work-related stress responses. And then I have a section talking about some perspectives, just to help frame, again, just to give some framing to what we're going to talk about. And then we're going to focus on what are some things for prevention and care. So that's just a quick overview. There you go. I thought it would be nice for you to be able to see me since you can't see me, but this is a picture of our family in Western Province, Kenya, but it's 30 years old. And I thought you might want to look at that while I just tell you a little bit about me, not much, but just to tell you this is the first time that I've actually given a formal presentation on this topic. I have worked for years with social work students and supervised many people. And so the topic comes up very, very often. It's always part of the conversation working with case managers in the refugee programs and other places. And so it was really interesting for me to be able to actually put this together and have a chance to talk about it, because I feel like I learn as I'm sharing with other folks. So here you go. So let's talk about some definitions. Stress is the physiological response that's activated when situations threaten us. This normal reaction prepares us to fight, flight, or freeze. It's also our perceived capacity to access the resources we need to respond to a challenge. And that's really important in this discussion, is the recognition that we are stressed when we can't access the resources we think we need. Okay, so what is trauma? Again, just to give us a framework for what we're talking about, this self-care, the burnout, and the other definitions that I'm going to give you in a minute. Trauma is a threat to ourself, our life, or our integrity. And that's really important, that we feel traumatized when our integrity is threatened. Another common definition of trauma is the loss of connection, and that's really pertinent to this conversation as well. And then, of course, trauma is the unique individual experience of an enduring condition when we're not able to integrate our emotional experience. And I know many of you heard last month the conversation about PTSD, and certainly that's very present in our refugee population that you all are working with. Okay, so grief. Well, why am I defining grief? I'm defining grief because grief is something within the refugee resettlement system that we don't talk about enough. And grief is a very, very present and important aspect of the refugee experience, and therefore it affects all of us. And so I define grief as the process of acknowledging and integrating the impact of a significant loss, often in a tangible way, that allows us to reorient to a new way of being. And then there's the concept of what's the difference between grief and trauma. And I always like to share this. I think it's important for us to recognize as we work with people that grief is present when we remember or understand that something happened in the past and is no longer going to harm us. But it's trauma when it feels as though those past events can still harm us. That comes from William Steele's work in the Traumatic Child Network, and it's very helpful, I think, for all of us as we look at the groups of people that we work with, as well as ourselves. Okay, a real quick reminder. We all have an autonomic nervous system that is what responds to stress. It's our system that, on the bottom you'll see sympathetic nervous system. That's the process that turns on. That's that fight, or freeze process that turns everything on, all these chemicals and body changes and heartbeat and a whole slew of things that help us to respond to that stress. Then there's a second piece, which is called the parasympathetic nervous system, and that's the piece that we often call the relaxation response. And that brings everything back down. So why does this matter? The autonomic nervous system has both pieces. And when we are stressed continually, and all that happens is that we turn on that sympathetic nervous system, the turn on, and we never get to the turn off, which is what happens when you're continually in stress, is you don't get that relaxation. Okay, so that was just a primer to set up. What are some of the work stress responses that we talk about? Well, we have created a whole sort of framework for this in work with in social services and in work with clientele. And depending on what you read or where you go, you'll see these different terms kind of interchangeably. You'll see them defined in different ways. And so we're just going to take a minute and kind of cull out a little bit of what some understanding of the differences are between burnout, compassion fatigue, and vicarious trauma. And again, they're used pretty interchangeably, but let's look here for a second. Okay, burnout. Burnout focuses, and I'm not going to read everything to you on the slides because I know you can come back and you'll be able to come back and look at them later. So, but burnout is really focused mostly on emotional exhaustion. When a person is really overextended, institutional stresses, feelings of depersonalization that lead to people feeling rather cynical and disconnected with clients. It's really about personal accomplishment, and often then is reflected in this sense of not being fully competent, not being fully successful in your work. And we're going to look at symptoms a little more, but I just noted that burnout is more about apathy, disillusionment, and irritability. So let's look at compassion fatigue. And again, these terms are often used interchangeably, but it's most often also referred to as secondary trauma. And most of the literature to distinguish between burnout and compassion fatigue focuses on people who, and I want to be really careful not to sound blaming, because none of these are about blaming. We'll get to that in just a minute. But that it comes from being overextended, and particularly overextended emotionally. And some of the literature focuses compassion fatigue on people's overextending their capacity to take care of other people when they haven't fully explored their own traumas or their own past, their own sensitivities. And so the symptoms here are more focused on exhaustion, being overly sensitive, feelings of helplessness, hopelessness. But again, you'll notice that even the symptoms overlap quite a bit. Okay, so then vicarious trauma. This is really interesting. I found a reference in 1990, this McCain and Perlman, that talked about people becoming infected by the stories of their clients. And so the difference here, talking about vicarious trauma, is when people who work with survivors of various traumas just become overwhelmed by other people's stories. And so you see that they talk about depression, difficulty with sympathy or empathy, and dejection. Dejection is just really a sense of deep sadness. Okay. All right. So again, I'm not going to read all these to you, but I know that you'll be able to come back to these lists and you can share them with your colleagues and maybe they can be helpful. But I wanted to point out that the symptoms of all these similar kinds of work stress categories are very similar. They overlap, and that they are in several categories. You have your physical symptoms, and you all know these. You've experienced them. You've seen them in other people. It's the physical stress. You know when something's wrong when you have some of these kinds of symptoms. And then there are the emotional symptoms, and we all know those too. We've all been there when somebody else was really having a bad day and very short-tempered or irritable, and we've experienced all of these as well. So these are the emotional kinds of symptoms. So this is reminding us that it's not just any one category, but our whole being, our whole person is affected. And then we have the cognitive symptoms, and those are, you know, the things that keep us from being able to think and focus. That stress response turns on all of that fight or flight. It's in a part of the brain that is different, is the back part of the brain turns on that fight or flight. So the frontal lobe, where we make decisions and think and solve problems, gets really cloudy because the other part of the brain is really agitated and taking over. And so you have the cognitive symptoms of stress that you see there. And then finally, all of that comes around to behavioral symptoms. And behaviors are the output of the other symptoms. And you can see that there's all the things that, again, that you're probably fairly familiar with in yourself or others when you're under a lot of stress, what kinds of things you experience. Okay. So I'm going to take a minute to talk about a couple perspectives that I have used with students and people that I supervise to just to give us again some perspective on what can we do for ourselves, what can we do for other people. And so I will tell you first of all that I tell people I don't believe in burnout. So what does that mean? That means that it's not that it doesn't happen. It's just that we have a responsibility, we as educators, we as leaders within agencies, we have a responsibility to give people tools and give people capacity, to give them resources. In other words, it doesn't have to happen, is what I'm really trying to say. And so I want to stop and applaud all of you for being here and taking the time to listen to this, because you're doing one of the things that you absolutely need to do to help yourselves and to help other people. So I want to applaud all of you for being on the line and listening to this, and hope you'll share it with other folks. Okay. So again, very quickly, burnout is not an event, it's a process. And that's important to be aware of, that burnout happens over a period of time, that stress wears on us, and that tells us that we have an opportunity to do something about it. Okay. Compassion fatigue. Compassion fatigue is about responding to the threat. And how is that threat reigniting our own trauma? Okay, so this is another way of framing how we think about compassion fatigue. And then vicarious trauma. How do, sorry, I lost my place because I can't see my screen. How do the emotions of others impact our own? So what is it that we can do to keep from taking on other people's trauma as our own? So I'm still giving you some framework here to help you. I think it's important that we have that so that when we look at the practices, that they make sense to us. They're integrated. Okay, so suffering. Suffering is a concept that in the United States we're not very comfortable with. We really work very hard to not have suffering. We believe that people don't have to suffer. And for most of you, you're probably aware that many of the refugees and the places they're coming from have a very different perspective on what it means to suffer. And so I think we have to reflect on that and our way of understanding suffering and what that means for us if we feel like we have to annihilate, we have to get rid of all suffering, because that then leads us to feeling inadequate when in fact there's still a lot of suffering in the world, and we're going to encounter it, especially in work like this that we do. And then one more concept that I just want to note. What does it mean to serve? I usually at this point tell a story about Spanish, and in Spanish the verb to serve is mandar, and in Mexico when you respond to someone you often use that verb and say mandi. In other words, in other places you should say como, like what, I didn't understand, what do you need? In Mexico you say mandi. And once I was told by a very dear friend who is Mexican that that was not a good word to use because it meant to serve. So the perspective that we sometimes have is that when we're serving, that we are somehow subjugated, that we lose power, that we don't have control. And I think that it's important for us to have some introspection on what does it mean to serve people. Does that mean that we are powerless, that we can't set limits, that we don't have some control over the choices that we make? And I think that, again, is another area that helps, in thinking about that, helps us to think about what is this burnout thing about? Okay. And I just had to share this this particular proverb, which I think is just take a little momentary break. When there's no enemy within, the enemies without cannot hurt. I think that's gives us a little perspective on the compassion fatigue concept. Okay, and then grief. I said we'd come back to this, and I just wanted to share. This is a grief curve based on the refugee experience. In fact, all the words in this came from refugees themselves. And why it's in this particular conversation is that it's a reminder that people go through deep grief when they're with us. If you look at the left end is shock and the right end is integration, well, most of our work with folks is at this left end. We don't get to spend a whole lot of time with them when they're finally integrated and feeling emotionally stable. We're present with them in that left side when all of those lists of emotions are present. And it's just a reminder that we're walking with them through that deep despair, grief, and other things. Okay, so what do we do about all this? It's a beautiful picture of Marrakesh there. Okay, one of the important things for us to focus on is remember that this is about managing wellness. It's a balance. And we have symptoms of stress, and then we have psychological resources. And we can handle a huge amount of stress if we maintain those resources. So the things on the right side, nurturing, having friends and relationships, social support, all of the things that build us up and hold us up. It's about this balancing act. That's really important. Okay, so we're at the nuts and bolts now. What are the things that we need to do based on all those things, that the definitions and the framework and the things that we were talking about? What do we need to do? We need to identify and process our stress. That means knowing yourself, listening to your body, identifying the things that are around you, finding ways to release those emotions. Okay, that stress response that we talked about, it turns on, and we have all those changes. We need to release. We need to process that. We also need to build support, connections, and resources. Remember that balancing slide we just had a moment ago? Those resources are really, really important. And building them up and having that around you. Know yourself and address your trauma. So that's a process that we all must go through. We must recognize when, certain circumstance. I've seen caseworkers together talking about different circumstances, talking about certain clients, and most, everybody's, talking about somebody, but one person will have a very strong reaction to something. When that happens to us, that's the time for us to say, okay, what is that about? What is it within me that feels that as a stress? And what do I need to do for myself to understand that, to process it, to figure out what it is that I need? And then, and these things are coming from me, but also coming from the literature, I was constantly, in all that I looked at, reminded us that we need to get training. And so again, I applaud you for taking the time to look at this topic and to spend some time thinking about how you can take care of yourself and within your agencies. Okay, creating wellness. Again, here are some pieces to look at, and just some different ways of framing this that might help you to think about your situation. You can be externally caring, but also have internal boundaries. And that means you can express that care, you can be supportive of someone who's suffering, you can listen without taking all of that on. And there are a number of ways that we can talk about maybe later about how to do that. Creating a balanced schedule that recognizes your strengths and your challenges. If you know that next week you're going to be doing, your whole week is full of things that are very, very difficult for you, that are the most challenging of things, you're not going to have a good week. So how do we, again, this is about knowing yourself, how do you look at that, your schedule, your activities, and how do you make sure that you're building in some things in there that you feel confident about, that you know you do well, that feeds you. Why do you do this work? There are things within the work that feed you. So what are they? Knowing how and who to ask for help. How many of you can say, and this is something we all have to practice because I don't think we grow up learning this, we have to be able to say, I need. And we have to be able to say, I need to a person that can respond to that. And again, that's building resources, building your connections with people. Who do you go to and say, I really need this? Are there certain things you can ask your supervisor for, your colleagues for, your family for, your friends? Knowing how and who to ask for that. So that takes practice. All of these things take practice. And then on the other side, knowing who and how to help that allows you some healthy detachment. How can you focus your energies most effectively to be helpful within your system? And knowing what are the pockets that you can't do as much for, and how do you then manage your feelings about that? How do you talk to other people about resources? How do you make connections for them so that they can get what they need? But recognizing that I as one person cannot do everything. At the Survivor of Torture Center, for example, I can't see everybody. There are certain people that I'm not going to be as effective with, and I'm really happy to have colleagues that can step in and do that. Okay, so this healthy mindset includes something that we might call accompaniment. Accompaniment is about being able to recognize and acknowledge that other people are suffering, that other people have pain, but not feeling like we have to be the ones to carry it. In psychological terms, we call this witnessing. In other words, we listen, we acknowledge, and we recognize that in that acknowledgement, that is a gift that we are giving somebody. We're witnessing to that, even though we can't fix it, we can't do anything about it, and then we have to learn to leave it there. We don't have to carry that alone. Okay. So, some rituals. Some practices, sorry. I was just checking in on seeing where we were in the process. We're almost to the end of the practices. So practices for reducing stress. Let's talk a little bit about these as we have some time. Rituals. I have tea every afternoon after I'm on days that I come back in the late afternoon to my home office and have a cup of tea. That doesn't happen every day, but most days I'm able to do that, and that's a check-in time for myself. I sit down, I have my cup of tea, I reflect on the day, I reflect on the next day. It's an important time, and it's a simple little ritual, but we can all build those things in. It's a way for me to recognize how I'm doing. Do I need something? Did I forget something? So it's an important thing to have those kinds of rituals, and it can be anything. It can be some of these other things that we have on the list. Relaxation. When we are stressed and that system turns on and all those chemicals are there, we have to have the relaxation. So again, it can be any number of things. It can be vegging out with a book for, even if it's just for a few minutes, 15-minute read in between meetings, or at lunch, or at the end of the day, the beginning of the day. It can be anything that brings your body down and brings your body into a center and gives you a little moment of dissociation. Those of you that remember the definition of dissociation from the last webinar, it's that release, it's your mind going away, What helps your mind to just go away and take a little vacation? Those are practices that we want to encourage. Walking. Walking is, if I have a client who's really struggling, I say to them, if you can just walk any distance, walking is one of the best. It brings on that relaxation response. It is, we call it bilateral because you're using one foot, then the other foot, then the other foot, then the other foot. So you're creating this rhythm that impacts your brain and releases stress. So any walking is always very, very helpful. But you need to be in the frame of thinking about relaxation. If all you're doing is thinking about work, it may not be as effective. But and then I just added a few things: yoga, journaling. I'm sure that we could, if we could have an exchange right now, that you would add all kinds of other things to this list. And we know what those things are, most of us. But one of the problems is that they're not integrated into our daily life. And that's the hard work. The easy work is to make that list. It's easy for me to make a list of, you could do this, you could journal, you could write, you could walk. But integrating these practices into your daily life, into a system that meets your needs, that's the really, really hard part. And so it takes practice. It takes practice practicing each of the things, and then it takes practice to make them part of, and again, this word integrated, to make them part of your system and your lifestyle so that it makes, so that it really contributes. I was recently talking to some chaplains at the hospital that see some of the really, really the worst part of life in the emergency room and that kind of thing. And one of them said, it feels like I have another to-do list. And so if it feels like it's just another to-do list, it's not going to relieve your stress, it's only going to increase your stress. And so finding ways that the right activities that work for you, that really feed you and reward you are really, really the most important thing. Okay. Then before we stopped, I just wanted to give you another quote. This is Ben Okri, who's a Nigerian writer and has written some really wonderful things. And this is just a reminder of why we do what we do. Why do we do this hard work? And his quote there, the most authentic thing about us is our capacity to create, to overcome, to endure, to transform, to love, and to be greater than our suffering. And that's what we try to bring every day to the wonderful people that we work with and for. And so I'll leave you with that, and then we'll see if folks have questions, if there's some specific things that need to be addressed, or questions about anything I presented.
Thank you very much, Dr. Rema, for your great presentation. I found that to be very helpful. I just wanted, before we start with questions, one of our participants had asked if you would share the PowerPoint, so I just want to let attendees know that we will be sharing the PDF version of the, Dr. Rema's PowerPoint slides, and also we are recording the webinar, so we will send out that resource to you all after the webinar. So as Dr. Rema said, we can go ahead and open it up to questions. I encourage you to ask any questions to Dr. Rema that you might have. And as I said, there is a chat function on your control panel on the right-hand side of your screen. So you can go ahead and ask those to myself, who is ECDC program staff, or you can ask the entire audience. While we're waiting for some questions, I did have one participant who was interested in hearing more about practicing caring with external boundaries. So maybe if you could talk a little bit more about what you mean about that.
Okay. We, as physical beings and energetic beings, we carry our sensory person with us all the time. And if we're not really, if you're not really completely aware of what that is, that's the energetic part of yourself. And so when we're engaging with people, I mean, you all know you'll be in kind of a not so good mood, and you'll go to the grocery, and somebody will be very bright and sunny, and you'll pick up that feeling, or it can be just the opposite. Someone's not being very kind. So, and we pick up that negative energy. Well, we're energetic people, and so we can protect that part of us from the suffering, from the trauma of other people by being aware of our space and our person. We can extend in very genuine kinds of ways attention, the way we listen, the space that we create in our office or wherever you're engaging people in the school or wherever. And you can really physically make that connection, but not allow the suffering, the difficulties to really penetrate into your being. And I'm giving a very metaphysical kind of response, but I think it's also a psychological way of thinking of, if you understand suffering, that people do suffer, it's a horrible thing that and the stories that we hear are, sometimes I can't even imagine these stories, and yet we can psychologically accept that that's the way the world is, and that I can just be present to it. And so to not think that I have a responsibility to fix something that's happened in the past or to fix a person. And that's the more of the psychological sort of response. I could probably keep talking, but I'll stop there and see if there are follow-up.
Okay, thanks. We're still waiting for some more questions. So again,
Okay.
I would encourage participants to ask questions if they have them. And if you're having any issues with that chat function, you can always email me, kayleetonga@ecdcus.org. But in the meantime, while we're waiting for those questions to come in, I see a few directors on the attendee list, and so I was wondering if you maybe had any advice or could speak to how directors or program managers, or those who kind of are overseeing the program that don't necessarily work one-on-one with clients, can help to foster a healthy environment for their case managers and caseworkers and kind of support them in their work.
Okay. The things that we can do in leadership is, there are a couple of things. One is that people need to feel purpose in what they do. They need to feel acknowledged and appreciated. They need, I think I said, connection. So things that allow people to not disengage because they're stressed, but rather bring them together in that stress. The other area is resources. One of the things that kept coming out as I did some looking at these definitions is that how important it was for staff to feel that they had resources. And of course, we all know we're living in, there are limits to those resources. And so being able to have honest, clear conversations and clarity programmatically about what resources do we have, where are we limited, how can we get more creative about the areas where we have limitations. Again, bringing people together rather than allowing people to kind of separate or move apart, because that connection, that honest conversation, that expression of concern is part of what will help us manage the stress.
Okay, thank you. I think we're still waiting on some questions.
Okay.
So in the meantime, I'm hoping we get some more. I also have another question.
Okay.
I was wondering if you could talk maybe a little bit more about the practice of mindfulness and meditation. You touched on yoga as one of the practices that you described, but I'm wondering if you could just maybe talk a little bit more about the practice of mindfulness and how it can be beneficial, because I know that when I was a caseworker, that's actually when I first got introduced to mindfulness practices, and I found it to be very helpful.
Yeah, I'm so sorry. Katie, we talked about this and I forgot to put it in there. Um, most of my work with students and with clients is in mindfulness. And so forgetting that, maybe, I don't know why I forgot that. Okay, mindfulness is the practices of being present to ourselves and being present to what's around us at any moment. We tend to think of mindfulness practices as sort of more Eastern practices, but even what I was describing about separating ourselves from the suffering of another person, that's really a mindfulness practice. It's about knowing where my body stops and where somebody else's body starts. Meditative practices, which are often integrated with yoga or other kinds of martial arts and Tang Kui and things like that, are really, really important. So if you can learn those and practice those, I start with the very first thing I teach most any client is diaphragmatic breathing. And that's just breathing in through the nose and expanding the diaphragm, and then slowly relaxing the diaphragm back towards your center with a breath out of your mouth. That is encouraging and supporting relaxation. Many people meditate for mindfulness. That's probably one of the primary areas. I'm trying to think. Help me out, Katie. What other things have you thought of, or what are you thinking of?
Yoga?
Yoga, yeah. Yeah, of course. Some yoga practices, and yoga comes from that Eastern philosophy, and so sometimes you have practices, just like with martial arts, that have been sort of changed a bit to fit the American mindset, and they're much more, just movement and that kind of thing. But you have many practitioners of yoga who teach it in that mindfulness frame, and so if you're looking for a yoga class and you want the mindfulness, you might want to talk to the studio or the yogi and find out how much of that they integrate. But in theory, the movement of the body and the positions is in that slow sort of process is meant to increase, again, our focus of in the present on our bodies and how we feel. You might learn something like progressive relaxation, where you sit and you work through the series of muscles in your body, and you tense the muscle, and then you slowly relax. That's it. So you might start with your feet and do that. Take your time, and then work up your calves. You tense the muscles, and then you slowly relax those muscles. And again, you're paying attention to what's present with you in your body. And we have all these images that come into our mind. We think about, oh, that thing I forgot to do, and so we have to work on how do you set that aside, how do you put that in a box or a container, and say, I'll come back to that later, and then come back to that center. And so those are what I call the passive mindfulness. In other words, it's very, we're sitting, we're being quiet, and sometimes we can't do that. Sometimes the agitation, the stress is so big that we need to move, and that's where you get, the things like the drumming and shaking and sort of dance kinds of activities. So movement that moves. And so if you're feeling in that more agitated, I need something physical, then you probably want to go out and walk or do some shaking. Shaking is kind of an ancient movement where you just literally kind of shake and bounce on your knees, and it releases a lot of the tension in your body. So there's both. There's the passive and the active mindfulness.
Okay, thanks. And I just wanted to add one thing to that. If you're feeling apprehensive about meditation or yoga, and you haven't really tried it, I was kind of like that before when people would talk about meditation. I think I had something maybe different in my mind. But if you're feeling a little apprehensive, you could check out different meditation groups in your area and grab a friend and, try it out, maybe with someone else if you feel more comfortable doing it that way. Because that's actually how I got involved with mindfulness when I was a caseworker. So just food for thought. We have another participant who she's describing meetings that her office has about once a week that are outside of the office. So, for instance, they may go to a restaurant or something like that to try to not, mitigate conversation about work and focus on their relationships. So she was wondering what you thought about activities like that and if you think that could be beneficial to creating a healthy work environment.
Sure. I mean, that's building relationships, it's connecting, it's, if we know a person and we have that human sort of connection, when there's a lot of stress or things are going on, we're more apt to be comfortable to say, hey, wait a minute, what can we do about this? Or, and not to retreat to that place of threat. Remember, when we're feeling threatened, that's sort of the core of the stress response. There's something happening. There's a lack of resources. I feel like I don't know how to do this. I feel like this client doesn't understand me. It's that threat that causes the stress reaction. And so being comfortable, being connected is a way of reducing that. So I think that's great, as long as people don't feel like it's an additional work requirement. Then you get into, how does it's integrated with my responsibilities, or is this just another thing I have to do?
Okay. Another participant has a question about when you were referring to disassociating, kind of for your own personal stress management. She says that often when she's trying to take time away or check out, or disassociate, as you would say, that sometimes people take it personally. So she's wondering how she can better communicate her need to check out in this way that makes sense to other people who may not understand her need to do this.
Okay, so it sounds like this person's talking about the sort of being with somebody when you're doing that. I guess you just have to say, excuse me, this is, I need some quiet, or I need some space, and I guess not apologize for it, but just this is sort of owning your own power and saying, I'm going to do this. But I guess it depends on who's around you and who you're sort of explaining it to.
I think maybe, let's say, for like a scenario would be you're meeting with a client and, they're maybe being resistant to the case management that they're providing, or they're getting, they're maybe angry or something and it's escalating, and this person, maybe I'm rephrasing what they're saying, but putting it in a scenario of working with a client, maybe emotions are running high and they feel the need to maybe step back and take some time for themselves. How to do this without making, the client feel like they're not important, or further maybe, not traumatizing them, but maybe, adding to the client's stress. Maybe that's another way of looking at it.
Okay. When you're with somebody who is escalating, their arousal, their sense of threat is turning on their trauma response, ideally, you want to engage that, with a lowered tension response. So you want your voice to get quieter. You want to sort of lean in and reassure people. Say, you know, it's okay. Let's take a break. And, you know, and then at some point it would be perfectly acceptable to say, I need to take a break. And so we're going to stop for a minute so that you can get a glass of water. And, you know, you can even say, I think we need a drink. I think we need to get up and walk around the room. All things that are going to help them, but are also going to help you. And so I think maybe practicing how to respond to that. I never really thought about that before, so that's helpful.
Thanks. It looks like we do not have any more questions at the moment. So, sorry, go ahead.
That's all right. As we've been talking, I wrote down labyrinth. And that is another mindfulness practice that if you have a small space, it doesn't have to be very big. In fact, they have tabletop labyrinths. A labyrinth is a curvy path that you walk, and so many places will have them in a park or something. And so you meditate in as you walk, you meditate out, and there's some questions that you can ask yourself. You can also get one that fits on a tabletop. So that you actually go through the labyrinth with your finger, and you can do the same practice. So if you need like a little mini labyrinth on your desk, you could do something like that. But walking one is also a great mindfulness practice. So
that's great. I've actually never heard of that one, so maybe I'll get one on my desk next week.
Yeah.
Okay. Well, since we don't have any questions, and Dr. Rama, unless you have something to add, I think we can go ahead and close.
Sure. I just want to reaffirm that being here and listening and going back to the taking the slides back to your group, that this is part of developing the practice, and I just really encourage you to develop the practice so that it feels like it's part of your life, because no matter where you go or what you do, there's always going to be stress. And so having those practices, once you develop them, you have them. And that's what's great about as you grow older, you develop that capacity and it stays with you. So good luck.
Okay. Well, I'd like to thank Dr. Rama for your time. I think it's going to be really helpful for our network getting these conversations started. I'd also like to thank the attendees for their participation. I hope that the webinar will be useful for your own work. I'm going to be sending out a brief survey like we did with the last webinar, so please be on the lookout for that regarding the webinar. And also just a reminder, this session was recorded, so we will also be sending that out along with the PDF slides from the presentation. So I would like to thank you all again and have a wonderful afternoon.